budgeting process for the next financial year 2024-2025 has started, and it is very paramount for us to have a conversation so that we can be able to pitch into our ideas and do advocacy and lobbying. But nonetheless, there is still that is not yet done, and we sit down and say what was not done in the last financial year that we can bring back to the next financial year. I sit with the teams from different organizations that are very conversant about the budget process to give us information about what the different processes are and where our entry points are. Please do remember that we face a challenge that is between technocrats, politicians, and citizens not knowing the different roles of who does what and who does not do what. It's very, very paramount that we share with you this information that can help you do your advocacy and lobbying. I'm Turyatunga Juna, and this is the Women's Show. Welcome to the show, women.
Thank you.
Thank you.
I am joined by Kanyesigye Evas. Evas is from the Civil Society Budget Advocacy Group, an organization that deals a lot with the budget. Welcome to the show, Eva.
Thank you, Becky. Once again, my name is Evas Kanyesigye, and I work with the Civil Society Budget Advocacy Group, a non-government organization that works on budget advocacy work.
Thank you so much, Evas. And Esther Mufumba from the Uganda Debt Network. Welcome to the show, Esther.
Thank you. Good afternoon, viewers and listeners. Good afternoon. My name is Esther Mufumba. She has introduced me. I work with Uganda Debt Network, an organization that works towards prudent debt management or public resources to the interest of all citizens of Uganda.
Thank you for giving us your time to come and educate us. Evas, I'll start with you from the Civil Society Budget Advocacy Group because you're famous for budget work. And what does and where is CSBAG located, but also what does it do so that citizens now know?
Oh, okay. CSBAG is located along Ntinda Nakawa Road. Yes. And to be specific on what we do on budget advocacy work, we analyze the national budget, especially different policies, and we advise government on the best practices or the best recommendations that can benefit every citizen of Uganda. We also consult different citizens at different levels across the country, and we come up with the best recommendations of practices on service delivery that we take to government and ensure we follow up so that at least government responds accordingly. Yes.
Thank you so much. With that background, what could you give us just a brief about the overall budget process? Just a brief of where our entry points are.
Okay, basically, of course, as you are aware, the current financial year allocation is 52 billion that is supposed to benefit every citizen. And where are women benefiting from this budget? The budget has basically allocated funds for the women. That's where we come in to appreciate the government of Uganda or the parish development model. We come to appreciate the government for the Grow Project funds. Government allocated, I think it's around 800 billion for the Grow Project fund, where women are supposed to benefit from that funds. We also come to where the government, I think, allocated some money for the Mulago Specialized Hospital, where women can also benefit from that budget. And but although we appreciate government has put in effort to do that, I think recently I was attending a women group meeting. I think that is still women are finding it a challenge to access that fund that is allocated to them. And the bureaucracy, the bank where that fund is put, they find it a challenge to get the fund. And one of them actually amused me that, you know how men are, for them they just juggle around and and get that money. But for us women, the bureaucracy is too much. The assessment they carry on our small enterprises is really so much. So sometimes even the fund ends up being taken back when they have not benefited. Yeah, so from that's where the women really, I can point out that they are benefiting from the budget. Yes.
Thank you so much, Evas. Esther, give us a brief about UDN, and I know that you do work with the Ministry of Education, and also where the child has an entry point under child financing in the budgeting process.
Okay, thank you very much, Becky. Yeah, I work with Uganda Debt Network. Uganda Debt Network is a national policy advocacy organization that works towards prudent management of public resources, ensuring that debt is well managed and to the benefit of all citizens of Uganda. So Uganda Debt Network, someone might ask, how are they involved in the budget process? So all the debt that the country currently has, which is about 86 trillion, remember these are public resources which are used to the interest of all citizens. So Uganda Debt Network, what is doing to make sure that how are the resources used, because we are all taxpayers and we have to service this debt. So Uganda Debt Network is conscious of how public resources are used, and with special interest to the children in this particular area. And where we've done analysis to see how our child-centric sectors or sub-programs are allocated for. And when you look at child-centric sub-programs, you're looking at health, you're looking at education, you're looking at social protection or social development programs, whereby the well-being of children is directly enshrined. And when it comes to the program-based budgeting, which we are currently implementing as a country, that is the Human Development, Capital Development Program, where children's rights directly fall. So in this current, the ongoing consultations, we are mindful that how are children issues taken into consideration. You're looking at financing for education. I've highlighted financing for health, because if children's well-being is not taken care of, it means the nation will not survive. And here in Uganda, the biggest population is children and the youth, because currently we have, is it a population of 46 million? But you find 55% of that are children and the youth. So meaning it is the biggest composition of our population. So if they are left behind, it means the future is affected. And that is why in this ongoing consultation, our emphasis has been around the issue of advocating for increased funding towards the education program, and with special interest, school feeding program, to make sure that if you're pushing for the universal primary education, how are we making sure that children are benefiting and can ably study in an environment where they are fed and they're able to achieve the outcomes of the UPE? Otherwise, if the children are not feeding, it means the enrollment will go down, absenteeism will be high, and in the end, it defeats the interest of UPE overall. That is why we've been pushed. We are working actually with the Ministry of Education to make sure the school feeding policy comes out, because currently we have the guidelines in place. I think they were released in 2013, but they haven't been widely disseminated. Those are the guidelines on school feeding. And the ministry is currently working on a policy to make sure there's input from the different stakeholders. Though from the interaction with Ministry of Education, it is a hybrid policy, whereby you're having, it's parent-led, as well as government intervening in areas like the Karamoja region that is quite vulnerable, and parents are struggling to feed the children as well as feeding themselves. So you can't say it will be a school parent-led program specifically for Karamoja. At least that is where we are at the moment.
Thank you so much, Esther. And I'll come back to you, Evas. Give us an overview of the current local budget consultation and what it means to an ordinary Ugandan.
Okay. From last month, CSBAG partnered with the Ministry of Finance and other stakeholders like Uganda Debt Network, Acorde. So we actually moved to the different regions, across the country to carry out these local government consultations. And when it comes to local government consultations, actually, according to Section 9(1) of Public Finance Management Act as amended, it mandates all local government MDAs, to carry out consultations in preparation for the development of the National Budget Framework paper. So at these local government consultations, actually it is one way of, promoting an inclusive budget process and, making it open and transparent for all. So at these local government consultations, it's a platform where Ministry of Finance gets to provide feedback to the citizens about the implementations of the recommendations of like the previous financial year. And also it gives them a platform where citizens can also provide their concerns. And here how CSBAG comes in is that CSBAG is a membership organization. So we have partners across, I would say, across the country. So we work with those partners to develop position papers. And these position papers usually entail the concerns of every citizen. Let's say, let it be education, let it be health, let it be agriculture. So those concerns are also presented at those local government consultations. So we expect the local government technocrats, we expect the Ministry of Finance, because also at those consultations, there are other technocrats from different MDAs. Let it be Ministry of Works, let it be EOC, they are all present. So we usually...
So we are having government, CSOs, and citizens, and local government.
Yes, and local government technocrats. Those. So different issues really are presented, from CSBAG. Yes.
So from these citizens, these issues are picked up by Ministry of Finance to go from the National Budget Framework paper.
Yes.
So what does it mean for a citizen to come for these budget consultation meetings apart from CSOs and government? What does it mean for a citizen?
Okay, well, when these citizens, attend, of course, they get to present and actually validate their issues because they're able to stand out and say, you know what, this secondary school or this primary school that you promised should be, built or constructed, your work is not happening. So because the different technocrats are there in charge, they're able to also provide feedback, whether it's actually happening or not. It's actually a space where the other citizens can actually hold their, their leaders accountable. Yes. Maybe if I could take you a little, like, from these consultation meetings, maybe let me start with maybe health. Some of the issues that were realized were like the staffing gaps. The staffing gaps are still a challenge, Like the health centers are there, but you find like one health center having one staff that is taking care. Even those staff are not present. So you find it is really affecting, the common citizen at that level. Then, of course, when we are also still seeing the challenge of salary disparities that is also affecting service delivery at local government. Maybe this is actually majorly affecting the schools, the teachers. There is so much of conflict that teachers, the arts and, and the science, teachers, they feel that the arts teachers are left out.
Yeah.
Yes, so it also brings that actually it was realized that teachers, health teachers keep moving, like after a certain period of time they leave the school and they are actually shifting to, to private schools, so which is affecting the service delivery. And that's why you find like our target is to have like one teacher to, to 45, pupils or students and all that. But of course, that won't be realized if these shifts are still, are still happening. It is still going to affect our service delivery. So we call upon government, to really do some work about it.
All right. Esther, how do we then utilize the local budget consultation meetings? I know that they are now over, but how do we now utilize for viewers next time when they hear that there are local budget consultation meetings to be able to input issues around child financing?
Okay. Usually the parish consultations that happen at sub-county level. So what we empowering citizens, they can participate in these parish consultations, because usually it happens at parish, then moves to the sub-county, then the district. So as Evas has rightly put it, you're trying to gauge priorities of citizens into the budget processes. It's an accountable measure, like platform. So you find some of the times when these meetings take place, citizens tend to shun them, thinking maybe that is not our platform, it is maybe for counselors, for the technical people. Yet, if they participate, they're able to indicate these are the needs of children in my parish, in my sub-county. In most cases, if they don't participate, we'll find counselors making their own decision on behalf of our community. Someone will identify a priority which is not actually the citizen's priority in that given area. So that's why when it comes to children, we are requesting the school, the head teachers, the school management committees, people to participate, because these are the governance bodies in schools, to participate in these meetings, because we've interacted with some of the governance bodies like PTAs, that's school management committees, and they tell you actually they're not aware even when these meetings take place. But when you go at the sub-county, they always put up this public notice, maybe at the sub-county. So as citizens, we need to be keen, interested in some of these public notices. They will not come to you or write individually that, Esther, come and participate in this meeting at the sub-county. But once they see those public notices at the sub-county, they should pick interest and participate. Because the other thing that that really affects children that never comes out, the issue of participation. Children don't participate in these processes, but they have representatives. And these representatives, are they participating in the meeting? Because they will not call all the children in a village to participate, but we have child representatives. We have, like, through their youth clubs, who are able to talk out some of these issues in conjunction with their teachers. That can be another way of making sure that children's needs are catered for, or they are not left behind.
Thank you so much.
Maybe to complement on Esther's point, actually, we just need to continuously engage in this budget process. It is actually our budget. This budget is for everyone, and maybe to call upon the youth. The youth should really be involved in these budget processes. The women should really be involved in these budget processes, because we tend to leave out those, platforms to the men. Actually, Esther, if you attended the local government consult, you find like the population of male participants is high. There is a colleague of mine who was telling me that there is a local government consultation that was happening, and they asked for a female cow, to take up the space and chair the meeting, but there was no one, and there was no one. So that means that if men are put in front of every platform, then who is going to push for our issues that are affecting us? Who is going to push for those issues that are affecting our children, especially in those policies? So that means our agenda will be left behind, and I mean, we are also left out. So let us take up those spaces and also push for our, our needs. And we believe government is able to listen.
Yeah. And I would like to throw the ball back. I know we don't have a government person today, but how do we advise government? Because now you see some of these things are government led, especially like parish, consultations. What do we put them in the local language? What are some of those recommendations? And I can pick them from both of you so that we do better advocacy for government, so that even the local person gets to know.
I think for parish, they're in local dialect. It's in a local dialect because they are looking at people, you're coming from the village. They don't want to complicate things. It's when you're moving out from the parish going to the sub-county, but still even at the sub-county, they will not stop me if I'm expressing myself in the local dialect because we are knowledgeable. There are those who are illiterate people. So I think citizens just have that fear. Like, oh, how will I enter in that? But
Office,
that space, I'm sure if I'm presenting my issue, at parish level, no one will stop you.
One of the challenges that technocrats have raised is the fact that we have leaders, our members of parliament, our councillors, that do not understand the budget language. Realistically, some do not understand the budget language and the roles of different technocrats. Esther, I would want you to come in here and at least give us at the local level, what's the role of the cow? Because they are saying, technocrats are saying we are having a challenge with councillors, but also when you find that their tenure is 5 years, sometimes new people come in. You cannot always teach them what the role of a cow is, what the role of at least a planner. Who are the key people that should be considered during financing or the budget process?
I think even before we go to the cows and the planners, the CDO is very important. That's the Community Development Officer who interacts with the citizens. Actually, that one is on a daily basis with the citizens. So, and that is someone you can easily approach. When it comes to issues, social development work, service delivery. Because those ones have the mandate to register what is happening in my village. They know what organizations, the different women groups in the community, those are all when it comes to the office of the DCDO, that District Development Officer. And then when we come to issues of financing, the planner, that is at the district level. Like what you've said, planning. We are planning. Even I can simplify it, basically. We are planning for our local government, a district. So he's the one to know all these priorities that are coming in from the different parishes, sub-county, district level. But remember, before even when they get to the planner, there's an issue of prioritizing. They will get so many issues from the sub-county. This one is the borehole. Maybe like about 20 issues from one sub-county. This one will come with 30, the other one with 40. But remember, at the district, they get indicative planning figures right from the ministry itself. It's telling them, because budgeting is upward and bottom upward. So Ministry of Finance will tell you, in this sector, we are allocating this amount. This is the ceiling. So whatever you are doing, you should be within that. So here we are at the sub-count. We brought a list of about 50 or 100 priorities from the respective sub-counties where we are operating. So they're all presented to the planner. So that is the time they have to have technical planning committees to say, how do we identify what are priorities from the different sub-counties. But this is not leaving out even issues that came out in the previous financial year. So that is when people maybe complain, for us, we've been presenting these issues for the past 5 years. How come they haven't been a priority?
Yes.
So like citizens, we always complain. So we are tired of participating in that process where even our issues are never taken on, because those are some of the feedback you get from communities that we've talked about this issue for the past 5 years. Yet, the planner is equally in a difficult state. Here you've been given, these are the figures that you have to work with. So out of that 50 priorities that have been submitted, how do we begin dropping some of the issues? We drop this, they will drop this, drop the other, depending on the priority of a given place. And for example, if there's 10 sub-counties in a district, you find they'll begin looking at in the sectors, social service sectors, what is coming out pronouncedly among the 5 or 10 sub-counties. This is feedback you get from planners when you sit and interact with them. So basically it is to make sure that the plans that are coming out from a local government are representing the interest of the citizens versus the available resources. Though there's an element of local revenue, that how are they using the locally generated revenue. But you find from the district budget, maybe the district has been able to generate 1% of their local revenue. And most of the money is coming from the central government transfers and maybe development partners. And that money is tied to specific projects, so you can't divert it. So those are challenges of the planner. Then even still goes to the chief administrative officer, the cow himself, is the accounting officer of a district. Meaning he is accountable for service delivery in his area. So when it comes to any service delivery, he should be in the know. He has to approve it. When it comes to issues of payment, the wages, he's in the know. That's why even when it comes to issues of ghost teachers or ghost personnel, somehow the cow is the one who is arrested, because for any transactions that have to be made, he should have authorized it. When it comes to contractors for any procurement, is the overall seer, the technical person. Like if it should have been at central government, we have the PS. So it is the cow who is the accounting person in the entire local government. Yeah.
Okay. Thank you so much for that brief, and I hope politicians now can know. And I'll come to you, Evas. And we know that we tend to give a lot of recommendations, but we have that challenge. How do we ensure that as citizens, or as the voice that has elected our leaders, are ensuring that they're not interfering with the work of the technocrats? Because we have that challenge. They're not interfering with the work of the technocrats, and the technocrats they're just monitoring their implementation.
Okay, thank you, Becky. Anyway, maybe I could give you the best approach that has worked for us for this budget process, because as we all know, it is our budget. We need to monitor it. We need to know what exactly has been allocated to us. We follow up on those, service delivery issues, and make sure, everyone is accountable, But we have this participatory development model, and this involves every citizen, and it starts basically from the grassroots. We have like different clubs, that we train and we equip them with knowledge, to know their budget. So if we come to this sub-county, we know this kind of village, and we know this number of women, men, because it is all, mixed up. They know their school. So we equip them with knowledge to know that in this financial year, this money has been, allocated. These are some of the government commitments to your school or to your health center in your village, and we give them the basics that this school is supposed to have this number of teachers. This school is supposed to receive money for the next term at this period of time. So that kind of group is given, so every quarter goes to that school, to that health center, you know, so they monitor their services, yeah, to find out that all this that government committed to do has been done or not done. So what they do after generating that, actually, like you've said, they're at the local level, but trust me, in that village, at least you'll find someone who is educated, you know, that would lead. And for them, when they're having their meetings, they actually have them in their local language. So it's just basically for you to interpret, and they know what they're supposed to do. So when they get those issues, those are the issues that we pick up. And actually we use at those different, you know, platforms. Let them be local government consultation meetings. Let them be those post-budget dialogues that you've heard about, the dialogue, the different, you know, engagements that we are having with the Ministry of Finance, the budget conferences that just, you know, ended, but we package it and make sure at least it reaches Ministry of Finance, or some of those issues that are included in the National Budget Framework papers that will provide recommendations to members of parliament, and they use certain issues, you know, when they are debating, you know, the national budget.
All right.
Yes.
Could you kindly highlight some of the achievable outcomes of that have resulted from the local budget consultation meetings?
Well, okay, maybe before I could go to some of the achievements, I wanted us to bring out the issue of parish development model, especially for the women, you know. So from the local government consultation, the issues that were coming out, okay, of course we appreciate government for giving that fund to that percentage at the local government, but I'm just wondering whether the 39% of all those people are going to, you know, to benefit from that fund. You get it? Because when we look at that kind of population, most of them have not even held money for, you know, for a long period of time. And you come and you're like, you know, here is 1 million. And this 1 million, of course, there is a list of school fees. You have children who are sitting at home. There is a list of
Needs.
Yeah. People are drinking, you know, because when we look at the pillars, I think there is the one of financial inclusion, then mindset. We believe that government would have started with the mindset change, you know, so that everyone is ready to receive that money and they know what they are supposed to use it for. Because now when you come and give the person 1 million, they're actually going to spend it. And another thing, when we come in as women, the challenge they are facing is that some of the women here don't know how to write. The national ID issue, like the bureaucracy of actually accessing it, is a bit hard. And some of the women, actually from that women, you know, group that that I attended to, someone raised the issue that some women, the men are receiving the money on their behalf, you know, or because of that background that, you know, you're supposed to, every penny that you receive, you give it to the man, and the man is the one who accounts. You get it? So money comes in, the next thing you see your husband coming home drunk. You get and the money is finished.
And yet you have
you
to
know, so
use it.
I believe government would have considered mindset change first before they went to, you know, to distributing money.
Pillar 5.
Yes, yeah.
And again, what is coming up is that still even some are not receiving the money.
Wow.
You know, not everyone has, you know, has received the money on the parish development model. And another thing that came up was there is no fund to monitor the whole process. You know, there is no fund to monitor the
Parish development
the
model,
parish development model, because they can't find out whether it is actually helping you. How are you using it? If you invested it in business, is the business working? Even the people that are in charge at the local level, they have no gadgets, you know, like no computer, because you need to capture people's details.
The databases.
You know? The databases. So they actually have nothing, you know, to use to really monitor the operationalization of that fund. So really, we hope and we pray that, you know, that it works out.
Okay, Esther,
so when it comes to some of the things that came out, and that are really working. We appreciate government, of course, for this audit that has taken place. And I think from the consultation, government was trying to commit that they are going to lift some of the ban on recruitment.
Recruitment, yeah.
Yes, so we hope some of those issues would be taken up.
Okay.
Yes.
Thank you so much, Evas. And to you, Esther, Evas has brought in the aspect of mindset change.
Yeah.
How do we then sit within this budgeting process and look at the school feeding, issue? Now that we've known the cow does this, the DEO does this, how do we change the mindsets of parents? Because you find that a child is going to school at 3 years. That is, I think, baby class. This child is maybe, let's say, they've eaten posho Monday to Friday. They're spending the day from 8, roughly. Those ones of Kampala will go by early as 5, 8 a.m. and come out of school by 5 p.m. or 4 p.m. But they've only eaten these meals that are constantly the same, not giving them nutritious meals. How then do we sit with ourselves, or as communities, or as we recommend to government during these consultations, and say, can we change the meals, the way children are having different meals, to have nutritious meals for children?
Oh, thank you. The first thing our recommendation would be to operationalize the school feeding policy, because as per now, it is still a draft. And given the processes of having a policy, we don't know how soon we'll get a policy in place. And what we were suggesting to Ministry of Education was, in the interim, as the policy is still pending, let's have that communication out there. In interim communication on school feeding. What message are we passing out to parents, to the different stakeholders, as we are talking about school feeding? Because the aspect of nutritious meals is very important. Having only one meal day in, day out, if you're able actually to access it, that's a different thing. But the nutritious part of it. And from what we've heard, what the ministry is looking at, they're not going to have like a standard meal for school children. But what they're looking at, given the different regions that the country has. Remember, we all have different foods in our region. So that's why the issue of giving milk is still being a problem in schools. Reason is, I think it's the Western area that consumes milk more. So if you bring milk and you're imposing it in the central, they might not be buying. So what the ministry, I think, is doing, and we suggested, let's look at some of the nutrients that a child needs for their development capacity. You're talking about proteins, you're talking about carbohydrates, you're talking about the different vitamins, minerals that a child will need. So if they go and say zoning, we say maybe Karamoja, Eastern, Central. What are some of the foods that when I take my millet, what food value am I getting? If I'm taking my porridge, what food value am I getting? So rather than saying, generalizing it, say all children should take milk. Maybe in the northern, milk is not that important to them. But what do they have in place that a child can take an equivalent of milk, which I'm sure is there? So those are some of the discussions we were recommending to Ministry of Education to be mindful of the different regions and the foods that are in that area, so that this kid can benefit from the different food values, and they are not only fed on one kind of food. Is it posho, or is it matoke? So which in the end it will not benefit the child's health value. And then the other thing that we were looking at for at least nutritious part of it There was an issue that is coming up in schools. I don't know if you've seen it or witnessed it in some area where kids now have ulcers. You find a young child, 5, 10, they are struggling with ulcers, and you're wondering, where is this coming from? Would it be the kind of beans that they are eating? Because we know most of the schools, beans, that has been since time immemorial. But what is the quality of beans that are being, or what is the quality of food that is being given to these children? Because at 10 years suffering from ulcers, why it's happening? Is it because they're feeding so much on these snacks? But you find these are kids in boarding school and they're coming back telling you, now, Mommy, I have ulcers.
And also the schools, you find that, Esther, it's break tea, and that is, let's say morning tea, they have given them porridge, let's say at 7.
Yeah.
Then they come and eat at 10, and then at 1. Rarely at 4, I think, then in the night if it's boarding. But you realize that a child is supposed to have a snack, something, maybe a fruit every 1 hour, by the energy and the way they play a lot. So how then do we sit back with ourselves and also the parents and say, okay, those ones that are going back to school, in their schools, that you pack for them enough food?
That is applicable maybe in Kampala, in the urban areas. But
even in the village, you can put your Irish potato in the
look at that
container.
vulnerable Karamoja woman. That is applicable. You are saying you can at least request the parent to pack a snack, a mango. Good enough Uganda is endowed with fruits, organic fruits. So how, if I'm able to pack a mango, a passion fruit, a watermelon, that is good. If a reader parent can do that, it is good. But there are these vulnerable communities where they haven't seen a meal. They're struggling to get food from government when they're bringing us that posho. And the live example is Karamoja. So if we are saying government is distributing to this, that's what we are pushing for Karamoja, because for it it's a given, it's a special place. So if government, at least they're saying they will be able to give them food, and I've seen most of that has been done by external funders, that is World Food Program. And unfortunately, from what I've been reading in newspapers, World Food Program, their funding reduced.
Wow.
So which implies in the next financial year, we are going to have challenges when it comes to issues of school feeding, because they have been handling it, they've been doing it massively. And government contribution has been quite little compared. But World Food Program is pulling out because they are having funding issues, which it means it goes back to us as citizens, as parents. And we are talking about now, let's have gardens. If schools, those that have land, let's encourage our learners, our children, to, instead of looking at gardening as a punishment, because most times, when I remember in school, when you do, like, when you would commit an offense, the punishment would go into gardening. But let's encourage that. I mean, it shouldn't only be looked at like a punishment, but to get food. Because at least that is sustainable if we have gardens for those with land. Then the other thing we are looking at from PDM, how do we leverage from some of these government programs? We have NUSAF in place. That's NUSAF 3. Then OWC, Operation Wealth Creation, as they are supplying inputs to sub-counties, different parishes, let them supply to schools, so that schools can have inputs, because there's an element, maybe we don't have money to buy halls, to buy these seedlings. But if Operation Wealth Creation can also be tapped into, so that schools can get some of these inputs and do their own cultivation. Otherwise, when it comes to issue of sustainability, where government maybe is giving food, it is not sustainable. But if a school can do gardening, then also we are calling upon, that is JILOS. For some of these offenders, they can do community work, go and cultivate in those school gardens, so that we are assured of food, instead of going slashing, is eating these simple punishments that are given to some of these criminals. They can do some work in schools, so that we make sure there's food for children, because this way of doing handouts, it is not sustainable. And then maybe some schools have done where they request parents to contribute. Is it either in cash or you asked to bring 2 kgs of maize? I think I was in Choli like 2 weeks back, where in some instances it has worked, where parents are saying, okay, we can contribute 2 kgs of meat, so that a kid can have a midday cup of porridge. They're not giving portion, but they're looking at midday porridge, so that a kid can push on maybe up to 4 o'clock and leave, because food, they're not doing it. They're not doing it. But again, like we say, sometimes politicians come and interfere in that. Okay, they call it intervene or interfere, and they just switch the words. Where they have come out and told parents, no, according to the guidelines, you're not supposed to contribute anything. Government is providing, is going to give everything under UPE. So there's that kind. So somehow, some of the parents now have relaxed. I think we had that in Guru, where previously parents were contributing and also maybe bring maize itself. But when there was politicians who told them, no, according to UPE, government is going to provide everything. So somehow now the local government now went relaxed on that. So in the end, it is the child that is suffering.
Yeah.
So as parents, we request you, I mean, you yourself as an adult, you can't study, you can't be at work the entire day without eating a meal. What about that 4, 5 or 10, 12-year-old? How do you expect them to push through as they're waiting for government facilitation? Wood will not come any month or day or so.
Yeah.
So that's it.
But again, anyway, somehow it beats our understanding. Okay, much as even those parents, by the way, they are unable to contribute because of our poverty levels, you know, because like from the local government consultations, the challenge is that the schools are really in a poor state. You know, some children are still studying from under trees. The building blocks are, you know, not there. Even the teachers, you know, accommodation is not catered for. You know, they have to walk certain, you know, long distances to, you know, to come and study. And imagine you walk over, I don't know how many kilometers, you reach the school. There is not even a cup of porridge. So really, at the end of the day, you expect someone to provide results. Really, I don't know. Really,
And
government
that's,
needs to do so much on, you know, funding for those schools.
And that's why I want you to come in on how do we, as, because most of the times, one time I was hosting, one of the religious leaders said that women, when the child is young, they are yours. When they grow, that's when a man claims them. And how do we, as women, come up with recommendations to our fellow women as we wait for government? And also because we need that children are budgeted for during, you know, the budgeting process. What workable solutions are we giving the women to say, okay, government is still, the budgeting process takes a whole year. So let's put in our ideas right now and say, what ideas do we give to women out there to be able to cater for the children?
From my perspective, maybe I would give a solution to maybe a certain group of women that, you know, we are women, we don't need to sit behind and wait for our husbands to provide. We have to push so hard. If there are these, you know, women funds that are provided in the budget, let us, you know, take up those spaces. Let us utilize those, the GROW project. Let us utilize the OWC, you know, funds that are in place and come up with our small, you know, enterprises, you know, our small businesses, push for them so that when we produce children, we are able to, you know, to fend for them. So even when, you know, those consultations are happening, let us have our ears, you know, on the ground, so that we participate, we push for our rights, our issues, so that, you know, we are able to fend for our children and, you know, and also develop and, you know, take care of ourselves.
Okay, Esther, I'll come back to you on the issue of child financing. We look at there are issues like health. When children get sick, the mother automatically will not sleep. How then do we ensure that children can easily access the health centers with automatically their mothers? Now it comes back to us as mothers. And how do we ensure that these are put in the budget?
What is happening, because maybe from last year, when it came to health funding, actually it's this current year that we are in, we are looking at, I think government has allocated some when it comes to U-Gift, where now they're upgrading health facilities from Healthy Center 2 to Healthy Center 3, which means they're looking at issues of personnel, increment of staff personnel, then issues of even the facilities, that is the medicines, how accessible are they? And I think I have to applaud the government. In the last financial year, here I'm seeing where we have 381 health centers. There were Health Center 2, we are now upgraded Health Center 3s. Then 250 Health Center 3s upgraded to Health Center 4s. Then 31 new Health Center 3s constructed in sub-counties where they never had any Health Center 3s. And we have 143 intensive care units and 5 high dependence units fully functionalized in national and regional referral hospitals. These are statistics that were achieved in that Ministry of Finance in the last financial year. So what I would say is to make sure that how equipped are these health facilities, because we know when the children, at least we have to appreciate even the infant mortality rate has reduced, given I think in like in the 1990s it was at 60-something%, but now it has reduced. So which implies that how do we make sure that the children under the age of 5 are not dying, then the newly born are surviving? These are issues to say that, do we have midwives in hospitals? Then in what condition are the facilities? When my child is sick, am I able to walk in? How accessible, first of all, is the health facility? Do I have to trek a long distance to access a health center, or are there nearby health centers within my area? And do I find medicine when I go there, or they are not there? And then earlier on, she mentioned the issue of sometimes the health workers maybe are not paid. So you find they are not motivated even to go at the health facility. Because once the health workers are well paid or timely, maybe it might not be well, but timely. This is something you have to first think about, timely. The other time we're seeing interns striking, meaning they hadn't been paid in a long time. So these are things that government has to be mindful. At least take care of the well-being of children, to make sure women, because as the children are sick, the women, you're equally sick.
Yes.
So that is the same group. When it comes to education, issues of inspection, are there school inspectors? You find the district, maybe there is only one school inspector, and you're moving in about 10 sub-counties. You can't do, when it comes even the funding for monitoring or inspection, the funds are quite small, which makes it inefficient and not done in a timely manner. To make sure how is the enrollment, absenteeism, kids are now shifting. For example, if I know the other school, they are getting a midday porridge, kids also shift to that school.
Where there's food.
Where there's food.
Yes.
I mean, it's a need. You shift where there's food. So these are things that we need to be mindful.
Again, in addition to that, it was also realized that from these the health centers, the issue of ambulances is still a challenge. You find a woman needs to give birth, has to walk a certain distance, or even when you reach that health center, they begin telling you that you have to fuel
We
the
have fuel the
ambulance,
ambulance.
and even fueling the ambulance is costly, so it's still being a challenge. Then also that the delivery, rooms
The
for
labor wards.
the labor wards, even the PWDs are not catered for. They don't care whether if you're a PWD, I don't know, you deliver, I don't know, in whichever situation, So I think government should also consider that to provide for everyone, It is our budget, let everyone be considered, whether you are PWD, whether you are, a mother deep down in the village that you need to move to the nearest health center, let everything be catered for and equipped for. Yes.
Thank you so much. And you bring in an aspect of gender responsive budgeting that caters for all different genders and that sees the EOC give, the certificate of gender equity. And it brings in the aspect of equity. You find that this region, they have been maybe suffering so much, and if you're to raise this gender or this child, we have to give in issues of equity that come in. How then best do we sit down with ourselves and give recommendations not only to government but also to the politicians in order to involve more women but in an equitable manner in the budgeting process?
Okay,
and that was the same question that I give it to you, that children but in an equitable manner. Yeah.
Okay. Well, of course, EOC is implementing that gender certificate whereby every MDA, before their budget is approved, they should be responsive to gender. So at least we have seen so many, adopting it, and they're working to achieving it, because I mean, if your budget is not gender responsive, it is usually, dropped, because it is now a requirement, that your budget should be gender responsive. So we recommend government and all the arms that are, participating in it, and we also continue to call upon government to continue adhering to it, so that at least every gender is catered for in the budget. Yes, so I'll continue and agree to the gender responsive, certificate.
All right. And to you, Esther, how then do we ensure that there is equitable financing for children's needs in the budget for the different regions and also the different children, like PWD children? We also have children now from the ones in Kampala, not the same as the ones in the village. I think Kampala, maybe the schools are a bit nearby, or there is taxis where you can put the child, but the child maybe in the village has to walk a long distance.
Yeah, definitely. The first thing you need to look at, the biggest coverage where is UPE. It's mostly in the rural settings. That is where you find most of at local government service delivery. So yeah, maybe in Kampala, UPE is there, but the beneficiaries are not so many as compared to the rural settings. So to make sure there's that equitability among children, it is still with emphasis on the Human Capital Development Program, because that one is the one that really caters for the children well-being. How do we, if you mentioned about the PWDs, then the children with special needs, those maybe sometimes have been left out, actually in most cases, but I'll be glad I think I'll mention in July of this year, when government came out and said they had increased on capitation grant by 20,000 per child. And even children with special need, there was an increment of 2,000 per child. So as they're giving 20,000, there's 2,000 more for each child with special needs. I think that was in July, effective July of this year. So we thank government for that, and we are saying we need more of that, because still it is a small percentage, but you first appreciate what you've received, because previously the capitation grant was less. So for me, my issue is ensuring that we are talking about health, education, social protection for children, to make sure that really children enjoy their rights, children are not left out, and they're able to learn in a conducive environment, they're able to access health, and also the issue that has been, I think, neglected more, it is the early childhood development center. That one government doesn't actually take care of it, and it is left to private entities who are profit oriented. So in areas where children, like actually in rural settings, where there are no ECDs, it means now the child is straight jumping to P1. In P1, so if you're, for example, you're spending 1,000 shillings on a child in P1, it means 600 is going to be lost, because they never learned anything in ECD.
Yes.
So mentally, physically, they are denied. They can't compete with a child who has done ECD. Yeah, so that is what I would say.
Wow. Thank you so much. I know that we are almost time bad. And as we conclude, what are the next steps after the local budget consultation meetings from you, Evas? And also give us your call to citizens and to technocrats and to politicians.
Okay. Well, from these local government consultations, of course, issues have been raised, and we, of course, call upon government to, to address most of these issues. And of course, we call upon government to provide an operational fund for both extension workers and the technical team that is in charge of monitoring the parish development model. Then we also call upon government to consider mindset change. Mindset change, especially so that the money they have given people for use is actually put to use. It is not wasted, because we are scared they may not be able to, to recover that money. Actually, some of them don't know that that money is supposed to be recovered after a certain period of time. Then we also call upon government to address the issues of staffing and salary disparities, because they are really affecting service delivery, at local government. Then from these local government consultations, of course, we have platforms that, of course, a national budget framework paper is going to be developed, and CSBAG and its partners usually review it and provide recommendations. So we have that slot.
Do citizens have an entry point to review the BFF?
To review, yes, because CSBAG usually consults different partners, and we actually develop that position paper, also with a different member organization, fellow civil society organizations.
So citizens at the local government level after do not have an entry point after?
Right now, they have already submitted their issues, so those issues were presented. So a budget framework paper is going to be developed, so CSBAG will come in to review that national budget framework paper and recommend and develop recommendations to Parliament, to consider why they are debating the national budget framework paper. Then we also have, we usually hold consultative dialogues. For example, we usually have a pre-budget dialogue, which usually happens like early March. We usually consult the public, so that at that point, citizens are able to, to provide input into that national budget framework paper. Then from there, of course, the ministerial policy statements are also developed and also CSBAG usually has a slot that reviews and also provides recommendations to government for consideration. Then we continue to, to have the post-budget dialogue. So all those are entry points for citizens to, to engage. So what I do is that I call upon citizens, let it be a youth, let it be a woman, let it be a man, it is our budget, it is our responsibility. So let us all be engaged and involved, so that we provide clear policies, clear recommendations into the budget that government should consider and benefit all of us.
Okay. Thank you so much, Evas, and it was great having you. Esther, what are your what's your call to government as we end the show, and also to citizens?
Oh, my call is on increasing allocations to community mobilization and mindset change, and specifically looking at social development, which has community-based services, and welfare of children falls in that category. You find like last year they were allocated, this operating year we're in, they were allocated 31 billion, but still there's a lot. But when it comes to, when you break it down, welfare of children hasn't been on the high table of that, and it is left mostly to development partners. And this, when it comes to the resource envelope of development partners, it is quite dwindling each year. So as government, it is time to take the upper hand. Otherwise, when children are ignored, even when it comes to health, you find the biggest funders of the health sector budget, rather, it's external funding. You're looking at Global Fund, you're looking at Gavi Fund, you're looking at World Bank, you said, are the biggest funders. I think 71% goes to external funders who are pulling out due to the different problems they're having back home. So which means once they have pulled out, it has to be funded by our government. So if government has been doing maybe 21, 27% of the health budget, it means that health is not going to be easily accessed as before. And here, children will be affected. So what we are requesting government, it is time now to begin re-strategizing at our local revenue. Because we are saying now, we're seeing where World Bank was cutting funding for some of the incoming projects. So we have to look at our locally generated revenue. And we prioritize health, education for the well-being of children, because it's not now sustainable depending on debts that we are still struggling to pay back, and then the donors are cutting funding. So let's strategize our locally generated revenue and channel it to child-centric priorities.
Thank you so much, Esther.
Yeah.
It is a privilege to host women that have information about the budget, and implore women out there to get involved in the budget process, because your budget, your responsibility, and understand that what you put into the budget might be what you get out. So if you're asking that politician to build for you a road and yet you did not put it during the budget consultation meetings, you might not be able to get that road. So please make sure that you know the budget process and try to learn as much as possible about the budget. Until next time, I'm Turyatunga Rebecca Juna. Bye-bye.